So this is Dr. Raul Vazquez. What we're trying to do is get a better idea how to come back from this COVID-19. And while it says the office preparation, it's throughout the building and everything that we're going to be doing in order to make sure that things are done right. So when we look at the practice triage, we're developing protocols based on the office in terms of what's going on out in the field. And I'll have two slides that show the community outbreak. And if we're anywhere between 6% and lower, usually the things that we're going to do are fine. If it does get up higher, then we have to kind of revert to a little bit of a hybrid of what we've been doing in terms of the telehealth, which we're still going to do, but it'll just make us force us to go in that direction uh, faster. Now, one of the things that we are developing is sort of the protocols and the talks off that's going to be calling these individuals will also mention these things. So anybody that's calling in with respiratory symptoms and fevers, uh, we need to know that before they come into the office. And the reason is we're going to develop protocols of where some of these individuals are going to be seen. We're thinking about using the main street as a COVID-19 type of treatment. So if people are sick, we can have them wait in certain sections, and also the two areas there, we can do more title care visits. So you're testing them, getting information, and then the providers can actually see these individuals in a separate section. And we'll talk a little bit more on the other slides. The other thing too is to give little packages. So we're going to have these respiratory preventive packages. We have them for testing outside, but we'll also have them inside the offices for anybody that comes in with these symptoms. And that's disposable surgical masks, facial tissue, and cleansing wipes. That's going to be real important. The reason that we're going to open the 1st of June is when I'm looking at the data, and these are the nasal positives, we tested about 269 people, 15 were positive, and we've been following through. You got a 5.5% rate. So that's one thing. And then the IgG antibody test, we did 544 people. And again, 27 positive, it's a 4.9%. So if we do what we're doing with these kind of numbers, we'll be okay in terms of coming back. Now, structural changes, we're going to consider separating symptomatic patients like we talked about. So they'll be going to a different location. If we can do a telehealth at home, that'll be best. But if they have to be assessed at any point because they're having other symptoms like shortness of breath, coughing, we're going to need to bring them in order to be able to test them. Again, reorganizing the waiting area, and we're going to also reorganize some of the sites for GBON in terms of the separation, similar to what we had before we left. That's exactly what we're talking about. 6 feet, it's a good separation with patients that do develop respiratory symptoms. So if they're in the waiting room on the main street area where we know, we'll actually place locations so people are 6 feet away from each other. Now, we're trying again. That would be for the respiratory symptoms, but it's going to take a little bit of time for us to kind of really get a better assessment of how to really do this. But in the beginning, like I said, there'll be hiccups, but we'll arrange the after hour setups for some of these individuals that may have these respiratory symptoms to come. But during the office hours, having them basically on the main street site may be of benefit to us. Now, when we talk about the transmission, we want to make sure that in the waiting room, so toys, magazines that were shared are no longer going to be there. And that goes for any other place within any of our sites. In addition to making sure that pens and clipboards and phones, things that patients share, that sometimes, that we basically, clean them. They just can't be used by multiple people. We have to kind of have some protocol. The same thing with dedicated equipment, stethoscopes, thermometers. We follow the protocols that we normally follow, especially with somebody that has acute respiratory infection. We clean after each use, and we've already been doing that. But it's going to be something we do. Also considering any disposable equipment when possible, and we'll be kind of progressing through that process. When you look at the contamination and disinfection, we want to isolate all the patients with suspected symptoms of respiratory infection. And that means with the remote site that we talked about. I think that's going to be really important because at that remote site, even in our regular sites, we want people to leave after their appointment quickly. And so try to document all the documentation in a clean area and try to really get the information as fast as possible during that time. Uh, Again, we want to make sure that that the cleaning is taking place, and we're putting protocols in place for that. We've already been talking as a team. Now, in all reception area, waiting areas, patient area, restrooms, we will have the sanitizers. There'll be disposable tissues, and we're also going to be having gloves and masks that will be given to a lot of this. All the staff will get that, but they'll have some that they could use going outside and when they're in the building for depending what other things they may be involved with. Now, in terms of patient referrals and transfers, I think we just have to make sure that if we have somebody that's sick, we're not going to bring them in for diagnostic. But people that are coming into the office will be people that are not sick that need preventive services, immunizations, testings, EKG, spirometry, things that they need, and bloods. Those are the individuals that are coming in. We'll develop patient educational material too, so that they know. And we've already done this, but more of it in terms of home isolation and processes to follow when they're home. Transportation, well, we said if they have it, they can come in. We've equipped our vans, and all the vans will have almost this COVID-19 model, and the drivers will be fully, shielded with PPE equipment during that time that we do, because patients are still going to require this kind of a service. Now, the human logistics for the office, we want to make sure we cross-train people, quarantine people. So we're going to have a scanner as you come in. If you're sick and you have a temperature, you're going to be tested, and you'll have to go home for smart quarantine during that time. The testing that's outside of 564 Niagara Street will still continue. And at this point, anybody that has these symptoms will actually be tested there uh, during this time. Cross-training staff is going to be essential, especially for the medical functions and functions of care coordination and value-based. So we just want to make sure if people are sick that the work still continues and how to really arrange those things. We're going to, again, have different alternative management plans, and the teams are meeting on a regular basis to make sure we do that. Now, these are just some of the websites you may want to go to if you have questions that are really good and really have accurate information, so we're not kind of giving you the wrong information. And this is just I put it in there so you know sites to go and kind of explore. We pull a lot of what we talk to you about from here also. So just want to thank you for listening, and it's just our way of kind of letting you know that when we do things, they're going to be planned and they're smart in terms of how we do open up this time. Thank you very much.